Environ Life Science Limited, partnering for life.
Hi, I'm Dr. Dipali Bharadwaj and I am a dermatologist. I practice out of New Delhi and they are doing fantastic work in informing people. So when they approached me to give a topic of skincare, I decided I want each and everybody today who's watching this video, each and everyone ideally who's going to go for a cosmetic surgery or a cosmetic treatment anywhere, should be knowing basic steps to be sure that they're visiting the correct doctor. Well, there are a lot of quacks in India who are claiming to be doctors. India is the only country where it has been reported 5 deaths in last less than 5 years during hair transplantation or after hair transplantation. The simple reason is to look good, to look fair, to have good skin, to have good hair is becoming a desire which everybody is craving for. Thanks to Bollywood, thanks to Instagram, thanks to the phone and technology, which has a lot of filters, and people believe that photographs is without filters and everybody can look like that. So to emulate is becoming popular. To become fair skin is something which a craze which a lot of Indians have. So it's not bad to have that craze, but you have to be intelligent enough to know whom you are visiting. Indian government, interestingly, has always had one very basic registration act, which is a state medical act. So if you're living in Maharashtra, you're visiting a doctor in Bombay, you will just type Maharashtra Medical Council, Karnataka Medical Council, Delhi Medical Council. I practice out of New Delhi and Mumbai, so I'm registered at both the places. Sara chatta patta, sab kuch, like as in all my CV, whether I'm a trained dermatologist, whether I failed in my exams or I'm a plain MBBS, you can check. Yes, you can check and you will be able to retrieve the knowledge very easily on internet. Please visit for your cosmetic purposes only and only to a dermatologist or a plastic surgeon, because they both have spent almost a decade of their life in studying on cosmetic stuff. So they would know best how to treat you. If you're falling prey to newspaper advertisements where a quack will do your hair transplant and you are one amongst those people who would lose their life, it's going to be very sad for people like me who are very upset with quacks. Recently, a newspaper item, we are today in June 2023, recently a newspaper item that a new NMC Act is upcoming, where a National Establishment Act of the clinics where skin and hair cosmetic clinics will be under supervision. I am thinking this is going to be a very welcome change. And I pray that in this certain rules are there, proper rules and regulations is there, because Indian doctors have intense experience. It's like kitchen in our student days where we see thousands of patients if we study or work at places like Safdarjung Hospital. So with what I mean is that it's very easy for Indian doctors to excel, but the Indian patients also need to excel. They need to know that the doctor they're visiting has degrees, is not just doing Instagram markets or Google ads or SEO for that matter. Secondly, even Indian patients should have realistic expectations. You should know that if you're going in for a treatment, what to expect, what not to expect. You should discuss with your doctor. It is your right before to do a Botox or a hair transplantation or a laser hair removal that these are the results you can expect. This is the result which will not come. It is laser, for example, it is laser hair removal. It's called laser hair removal in newspaper ads. But if you ask a doctor like me, it is laser hair reduction. So there is going to be a 90% maximum reduction in the number of hair that you have in your body. It can never become zero. So we can only reduce it, say, by about 90%. So please understand realistic expectations and what is possible and what is not possible. There is a huge difference. Stick to the doctor who will explain you what you're getting what you're getting into, that what is the results you can expect, what to not to expect. Always follow the pros and cons. Always play it safe. Always wear a sunscreen. To sum up my topic today, basic skincare to maintain the skin quality, most important is always a sunscreen, which is a UVA B C blocker. The quantity you apply is again important to know. Like our finger itself is a measuring tape. There is 1, 2, 3 boxes which everybody have. So you need to have 1.5 box. This much quantity of sunscreen for Indian skin is needed. Secondly, you need to apply 10 minutes before going in the sun. You need to reapply it if you're continuously in the sun beyond 3 hours. You need to apply it every 2 hours if you're in the swimming pool or on a snow place, because both of these places reflect sun. Sunscreen is extremely important. Please don't ever forget. And whitening, skin whitening, the craze as we were talking. Anybody who the color behind your ear, on the skin, jo color yahan pe hai, the color behind your ear, that is a color any good dermatologist can give you with glutathione injections, tablets, syrups, etc., patches, or tranexamic injections, blah blah. So this is the color which you can achieve. But if you are dark here, please don't waste your time and, more importantly, money and hope, because one cannot make you fairer than the color over here. So stay blessed, and please ask us in comments questions of topics which you would like to hear, which will make easy for us professionals who want you to be very informed people. Please understand, ये आपका right है, आपका जनसिद्ध अधिकार है कि जिस डॉक्टर के पास आप जाएं, आपको पता हो कि वो डॉक्टर है, वो सिर्फ एडवर्टाइजमेंट नहीं कर रहा है, या ये पैसे की दुनिया में पैसे कमाने के लिए नहीं बैठा है. So always visit a serious professional who knows his or her game, जिसको अपना काम आता हो, जिसकी डिग्रीज हो. तो उस तरह के डॉक्टर के पास आप जाएंगे तो आपको अच्छा रिजल्ट जरूर मिलेगा. थैंक यू.